Hi, my name is Lori Floyd, and I'm making this video as part of my MU 607 Advanced Health Assessment class at Jacksonville State University. This is a mental health status exam. My patient's waiting in the room, so I'm going to go in and meet him. Hi, my name is Lori. I'm a practitioner. I work for this clinic. I'll be performing an assessment today and also collecting a history. Can you tell me your name?
My name is TJ Floyd.
Okay, can you tell me your birthday?
It is 9/19/91.
And can you tell me today's date?
Yeah, it's 9/19/2019.
Alright, do you have a preferred name that you like to be called?
Yeah, you can just call me TJ.
Okay, TJ. Well, I've already washed my hands. I've got some gloves I can put on if I need to perform an assessment. So we're going to go ahead and get started. Can you tell me why you came into the clinic today?
Yeah, I moved here about 3 weeks ago, and I was just looking for a family doctor.
Okay. Well, welcome to the area, TJ. I hope you find this clinic helpful and reliable. And I know that you're here just to establish care, and that's fine. But if you want to tell me about any other problems that you've been having lately or any issues?
Yeah, I've been having real bad anxiety ever since I started my new job 3 weeks ago.
Yeah.
Been having some pretty bad anxiety.
Okay, well, right now I'm just going to ask you a series of questions that's going to help me better understand this problem that you're having, okay?
Okay.
So can you tell me when these symptoms first started?
Yeah, 3 weeks ago when I first started my job.
Okay. Is there any location on your body that kind of notifies you to I'm having anxiety or I feel stressed?
Yeah, I have an increased heart rate and I get real jittery.
Okay. How long do these feelings of anxiety usually last?
15 to 20 minutes.
Okay. And can you kind of describe the characteristics of the anxiety that you feel?
Yeah, like I said, it's usually increased heart rate and I get real jittery.
Okay, I understand. It does sound like that is consistent with anxiety, which most people experience throughout life. It's usually just a normal process in life. Is there anything that makes your anxiety or your stress worse, or anything that makes it better?
Yeah, when I go to work in the mornings, I get very bad anxious, but when I come home and I sit down in my recliner and just read and relax, I feel a lot better.
Good. Okay, can you tell me maybe about a time when you feel like your anxiety was at its peak, the worst that you can remember it?
Oh yeah, it was the very first day of work and it was bad.
Okay, and the last question would be about severity. How severe is your anxiety? For example, does this stress and anxiety interfere with your activities of daily life? Does it keep you from resting at night? How severe is it?
Yeah, it doesn't really keep me awake at night or nothing.
So it's not very severe, maybe
No.
mild.
Yeah,
Maybe would be a good word for it.
Yeah.
Okay. All right. Well, now that I know about the problem that you've been having, I want to get a little history about you and get to know you a little bit better.
Okay.
So we're going to start out first with your allergies. Do you have any food allergies?
I do not know.
Okay. Do you have any environmental allergies? That would be like dust, hay, animals, latex.
No.
Okay, nothing like that. And do you have any medication allergies?
Yes, I'm allergic to amoxicillin.
Amoxicillin. Okay. Well, what kind of reaction does amoxicillin cause?
Causes a rash on my arm.
Okay. Why in the past have you taken amoxicillin? Why did you need it?
Well, I had bronchitis, and the doctor prescribed amoxicillin, and I broke out in that rash.
Okay. Do you remember about how long ago that was?
Yeah, that was several years ago, not when I was about 19 years old.
Okay. Have you had bronchitis again since then and needed another antibiotic?
No.
So you haven't really come into contact with that problem.
Mm-mm.
Okay. All right. Well, we'll add that to your allergy list here. How about any medications that you take? This would include prescription meds, over-the-counter meds, supplemental meds.
I take Tylenol.
Take Tylenol. What's your normal dose of Tylenol? 650, 325?
325. Yeah.
325? Okay. Why do you normally need to take Tylenol?
Get bad headaches.
Does the Tylenol seem to help the headaches?
Oh, yeah.
Yep. Okay, I'm going to go ahead and kind of ask you about your headache pain. Where is your pain at usually when you have a headache?
Usually right here above my eyes.
Okay, across your forehead?
Yeah.
Okay, on a scale of 1 to 10, how bad is your pain when you have a headache?
About a 3.
Okay. And can you notice any patterns or triggers to these headaches? They're just kind of
random.
Are they frequent or infrequent?
Infrequent.
Okay. And when was the last time that you needed Tylenol for a headache?
About 3 months ago.
About 3 months ago? Okay. So medication's good. We're going to go into your past medical history. And I know you told me you had bronchitis in the past, but is there any other medical conditions you need to add?
No.
No. And then just these anxiety attacks have been the last few weeks or so?
Yeah.
Okay, have you ever been hospitalized for any reason at all?
Mm-mm.
Any surgeries?
No.
Nothing like that? Okay, good. I'm going to go ahead and kind of ask you some questions about a psychiatric history. These questions aren't meant to scare you, and they don't mean you have a problem. They're just going to kind of give me a better idea of maybe this present problem that you're having right now. So have you ever been depressed, or have you ever been clinically diagnosed with depression?
No.
Have you ever had any thoughts of self-harm or any suicidal thoughts?
No.
Okay. And before 3 weeks ago, had you ever had any feelings of anxiety or stress?
Yeah, come to think of it, I did. When I was in high school, I worked at a local pharmacy, and I would get anxiety attacks there too.
Okay. Were you kind of anxious when you first started your job?
Yeah.
And then did it ever get better or resolve?
It got better, but it stayed.
It was still there. Okay.
Yeah.
All right. And last is, have you ever been diagnosed clinically with any kind of psychiatric disorder?
No.
Nothing like that.
Mm-mm.
All right, sounds good. So we're going to talk just briefly about some screenings, health maintenance, immunizations. So is there any kind of routine screenings that you participate in?
No.
Okay. And for your age, you're a young man, there's not really any screenings for you that's recommended yearly right now. Later in life, in your 40s or 50s, there will be some screenings, but there's not really any right now. Do you get your have you got your immunizations? Like, did you get all your childhood vaccines?
Oh yeah, I got my blue card and everything.
Okay, good to know. Is there any yearly vaccines that you get, like your flu shot?
Yeah, I get a flu shot every year.
That's great. And up to date on your tetanus boosters and all that. Okay, that's good. I'm really happy to hear that you take part in your health like that. You get your flu shots like you should. You got all your immunizations, and it sounds like you're a pretty healthy young man. Take care of yourself.
Try to.
All right, now we're going to move into your family history. So we don't have to be very lengthy and extensive, but we really want to make sure we get your blood relatives. So we want to focus on your grandparents, your parents, and siblings if you have any.
Okay.
So if you could tell me a little bit about your grandparents' history and also their ages.
Yeah, my mother's parents, they're both 74 years old, and there's nothing wrong with them. They're fine. My dad's parents, they're both 83, and my grandmother's fine. My grandfather has high blood pressure.
Okay. All right. And can you tell me about your parents and along with their ages?
Yeah, my mom and dad are both 50 years old, and they both have high blood pressure.
Okay. And if you have any siblings, can you let me know any health problems they have?
Sure. I have a younger brother, 25 years old. He's fine. Nothing wrong with him.
Okay. So I'm just going to hit some high points here, and if these don't apply to your family, you can just say no. But any history in your family of, we'll say, diabetes, thyroid problems, cancer, nothing like that. No big stroke, heart attacks, nothing like that. Okay, good. Glad to hear it. All right, now we're going to talk about your social history, and this kind of just encompasses your whole life. Some of these questions can be personal, so if you don't feel comfortable answering them, just let me know, okay?
Okay.
All right, are you married?
I am very happily married, yes.
Okay, how long have you been married?
About 15 months now.
All right, that's nice. Can you tell me, I know you said you just moved here to start your new job, so can you tell me maybe about what kind of job you do, your work environment, things like that?
Yeah, I work as an accountant at a city bank.
Okay.
And I mostly just sit in my little cubicle and crunch numbers all day.
Do you feel like you have a pretty peaceful work environment, not?
Kinda, yeah. Yeah, most everybody leaves me alone.
You just stay at your computer and do your work? Okay, you sit a lot at your job?
Yes, a lot, yeah.
Can you tell me a little bit about your college education and your high school education, just any education that you've had?
Yeah, I'm a high school graduate, graduate with a bachelor's degree in accounting, and I have a master's degree in accounting as well.
That's great. Okay, I'm going to kind of ask you now about some spiritual support. Do you identify with a religion?
Yes, I'm a Christian.
Okay.
Go to a Baptist church.
Okay. Can you tell me maybe about your support group? Do you have family, friends, people that you can rely on, people that support you?
Oh yeah.
You feel well supported in life?
Mhm.
Like you have people you can go to if you have a problem?
Oh, certainly. Yeah.
Okay. Do you now or have you ever consumed alcohol?
No.
Okay. Have you ever used any kind of tobacco? This would include cigarettes, e-cigs, vapes, chewing tobacco?
No.
Nothing. And then last is, have you ever used or do you currently use any kind of legal drugs or illicit drugs like heroin or meth?
No.
You say no to that. Okay, so those were kind of the tougher questions. Now we're going to move on to a little bit more casual questions. I'd like you to tell me a little bit about your diet. What do you typically eat?
I usually eat just home cooked food. I don't eat out a lot.
Mm-hmm.
Mostly just typical home cooked food.
Yeah, no food allergies. You don't have any foods you can't eat because of beliefs.
Right.
Okay. If you could tell me a little bit about your activity. Do you exercise on a regular basis?
Yeah, well, not as much as I should, I'll admit. Usually a day or two a week.
Okay. Yeah, the typical recommendation usually, if possible, 30 minutes a day, 3 times a week is a good moderate exercise, but sometimes you just have to work it around your lifestyle.
Mm-hmm.
Can you tell me about any hobbies that you have?
Yeah, I like to read a lot.
Great. All right. Have you ever served in the military?
Mm-mm.
And have you been outside of this country in the last 6 months?
I have not, no.
All right. Good. So that was mostly just our comprehensive meeting you exam, also including the mental exam. I'm going to go over a quick review of systems, which most of his review system is non-contributory. He's healthy, most of his are negative, but he does constitutional, deny fever, chills, and unexplained weight loss. Cardiovascular, heart health-wise, no chest pain, no syncope, no edema. Does report and maybe occasional palpitation, a feeling of increased heart rate. It's usually accompanied by his anxiety. His lungs, he does deny shortness of breath, coughing, wheezing, doesn't have any breathing problems. And then as far as the psychiatric review systems, does deny depression, does deny suicidal ideations, but is positive for anxiety and stress. And then all other systems are not contributory. So we're going to do just to kind of wrap this up, a little mental status exam. And this is just going to kind of assess your memory, attention, focus. It's just going to kind of give me a little idea about, it's kind of like a neurological exam. I think that your problems are mostly environmental, but we're just going to do a little exam while you're here, okay?
Okay.
All right, they're very simple. I'll provide you with instructions. Are you ready?
Yes.
All right, first I'm going to say aloud 3 words. Take a moment to hear the words, to remember the words, and then tell me the words back, okay?
Okay.
All right, pencil, car, door.
Pencil, car, door.
Perfect. So now we're going to do kind of an arithmetic question. So we're going to start with the number 100, and then you're going to subtract 7 from each total that you get. So you're going to have a smaller number each time. And just do that a few rounds, and I'll tell you when to stop, okay? So we'll start with 100.
100, 93, 86, 79, 72, 65.
Perfect. Good job. You did great. We're also going to ask you if you can spell the word world backwards.
DLROW.
Perfect. And then finally, I'm just going to ask you, if possible, can you tell me the 3 words that I asked you to remember earlier?
Pencil, car, door.
All right, you did great. And like I said, that was just a small, it tests your memory, your focus, and attention span, and you did great on all those factors.
Okay.
So this pretty much completes my exam for you today. I am going to go document and chart all the information that you've given me, try to come to a diagnosis, and then create a treatment plan that we can provide for you. Is there any questions that you have for me before I go?
No.
No questions? Okay, so at this time, I'll go chart, document everything that TJ has told me, and I've come back. I'm going to run through a quick differential diagnosis, and then we'll be done. So differential diagnosis 1, mild anxiety related to stress. Differential diagnosis number 2, transient tension headaches. Plan for TJ would be keep anxiety log for triggers, educate regarding relaxation techniques, educate regarding distraction techniques. You may need a referral to a counselor or therapist if the problem persists. No need for medication intervention at this time. Continue over-the-counter Tylenol for headaches. return to the clinic if the problem worsens immediately, or do a follow-up appointment in 1 month. Thank you.